Talk to Joe on 1850 715 815.
51551 is our text. We have been surprised, to say the least. A number of people have contacted us since that first call about vertigo and looking for information and advice and tips even. June Duffy. June, good afternoon.
Good afternoon, Joe. Thank you very much for taking my call.
And thanks for making the call. You say you suffer from a condition similar to vertigo.
Yes, it is. It's called P.O.T.S. It's postural orthostatic tachycardia syndrome. Hard to say.
Yeah. And hard to endure. Really, how did it start?
Yeah. Well, I was involved in a car accident 3 years ago now. I was a passenger in my colleague's car when we were on the route to Galway. And the front of my colleague's car went into the side of another car. And that resulted in the ambulance being called to the scene, and I was taken to the UCH initially, and I had fractures to my back and a head injury, concussion, and I was transferred to Merlin Park then following that, and they measured me up for something called a tailor brace, which I had to wear for the next 6 months. So the brace was from the neck down to the base of my spine, and it, if you will, it was like a corset-type brace that you wore on the outside of your clothing.
Okay.
So I was in that for 6 months, and it was when that came off, and I felt that I'd recovered, and I had recovered from the fractures, that I started to collapse, and I couldn't even sit up in bed.
Your balance went?
Yeah, my balance completely went, and I passed right out. My heart was racing. I had extreme fatigue, and I just couldn't get out of bed at all, couldn't even sit up in bed. I was transferred then, about 2.5 years ago this was, to the Mayo General Hospital over the Christmas period, and I was there for 3 weeks. And they transferred me to the Mater Hospital in Dublin, and they put me on something called a tilt table test, and they found that I had incidences of the P.O.T.S, and it involves a heart racing beat and drop in blood pressure, lightheadedness, fatigue. So those are the symptoms I generally suffer from.
And your heart rate rises when you stand up?
Yeah, when I move. It's when I try to move, when I try to get up from lying to sitting, when I'm turning, when I'm sitting on a chair, getting up from the chair. So it's any kind of movement. And they placed me on medication which really stabilized the condition for a long time. So I have 2 kinds of medication that I take now. And I do attend a specialist physiotherapist when I'm able to, and I'm not having what I call episodes. Unfortunately, about a year ago, I seemed to be doing fine. I'd gone back to teaching, but I had what they call a relapse of my serious conditions, and again, I started to almost faint. So I had all the bad feelings of similar to vertigo, the dizziness, but the heart racing and the drop in blood pressure. So this meant that I had to lose my job. So I'm now at home, retired from teaching, took early retirement, and I've stabilised to a certain point where I have what they call flare-ups or episodes as we go along. So
and you're on medication
where I am at the moment, Joe.
Wow.
But I'd like to say I really empathise with the last caller and all the callers you've had on your show over the last couple of days, because the trauma of the accident was bad enough, but the aftermath is what nobody can ever come to grips with and explain to you. And it affects so many people in so many different ways, and I feel so blessed in a sense that I am on my feet and I am able to get round to a certain extent. So I do want to say, all your callers have been so brave and so courageous in their approach to dealing with the issues after accidents.
Okay, stay there for a sec, June, because Patricia's on the line. Patricia, when you got your first vertigo attack, what did you think was happening?
Well, Joe, I didn't really know what was happening to me. I thought I was dying. I thought I was having a heart attack or dying. It was just a continuous spinning and feeling very nauseous. and you were holding on for dear life to something, whatever you could get a grip of, even though you were sitting down and knew you weren't going to fall. You felt as if you were falling all the time. It was very, very frightening.
And in terms of you got a diagnosis, obviously.
I have Menieres for about 10 years or more, but I only got a diagnosis about 2 years ago. I changed consultants, I changed doctors because I wasn't getting anywhere, and my new consultant sent me for a balance test to Dublin. I went to the Beacon Clinic for a balance test. I had that done there, and I was diagnosed then with Menieres disease. And you had a previous caller on, I think it was either yesterday or on Tuesday, who had the gentamicin procedure done. Mm-hmm. I've been offered that procedure as well in Beaumont. But the gentamicin procedure, I'm actually practically deaf on the right side. And that's one of the symptoms of Menieres. Yeah. And if I get the gentamicin procedure done, I would be totally deaf on the right side. But it would also mean that I would have to learn to get my balance again for quite some time.
Okay, Professor Gerald Leonard has contacted us. Gerald, good afternoon.
Good afternoon.
And I know you're an ENT prof, but you're good. Thanks. You're working in the States, but you want to talk about vertigo and the whole issue of and obviously all the cases we've heard about in Ireland. Everyone has been very happy, it seems, with their medical interventions they've come across. But it seems to be much more common than people think.
Well, first of all, vertigo is not really a diagnosis. Vertigo is a symptom.
Okay. In
the same way as headache is a symptom, and headache could be migraine, it could be a brain tumor. Vertigo is a sensation of spinning of your environment around you or you in relation to your environment. And there are many causes of vertigo, Menieres being one of them. So some of your callers over the past few days mentioned things like benign positional vertigo, and others had Menieres. And though they both cause a sensation of spinning, the underlying problem is different.
Okay.
Menieres is a change in the fluid dynamics of the inner ear. We don't actually know why that happens. We know what the changes are, but we don't know why that comes on in some people. Over here, we would tend to emphasize that patients adhere to a low-salt diet, less than 1,400 milligrams of salt per day. That helps a lot of patients without going on to anything different. We supplement that sometimes with a diuretic, which makes you pass potassium. That tends not to be used that much in Europe or in England or in Ireland, but it would be used more over here. And most patients, you can control the episodes. Now, a number of patients have been talking about gentamicin, and gentamicin, for patients who are not controlled, we're talking about Menieres now, for gentamicin, for patients who are not controlled with conservative management, has revolutionized the care of patients with Menieres.
Now, the people who mentioned it so far are people who are having drop attacks, isn't it?
Well, if you have a drop attack, and it's called the name is a Tumarkin drop attack, so that can be quite dangerous. For example, if you're driving your car and you get one of those, you could be over the ditch. But gentamicin, I think there's maybe some misconceptions about it from some of the comments I've heard. It causes in about 30% of patients, it causes a little drop in the high frequencies of hearing. And in about 1% of patients, it causes a total loss of hearing in that ear. But for example, your last patient that talked about being offered gentamicin, if she has little or no hearing in that ear, or she's down at where it usually flattens out, is usually at about 60 decibels, which is usually in the severe range. Even if was unfortunate to be in that 1%, that's not a huge loss because her hearing is probably not very useful on that side anyway. But it's only 1% of patients will lose all of their hearing. With regard to adjusting, what typically happens about 2 weeks after the gentamicin is done, because of the changes that occur in the cells of the inner ear, the gentamicin is injected into the middle ear, and that diffuses into the inner ear and actually causes damage to your balance organ in your inner ear. And after about 2 weeks, you'll feel just a little bit tipsy, like as if you've had one too many. And then that will settle down over the period of about a week or so. Usually, when you have a steady, stable situation, your brain can make an adjustment for that steady, stable situation. Where you have problems is where you have a fluctuating input coming from your ear. That's when the brain says, whoops, what the hell's going on? I can't deal with this. But when you've got a steady, stable situation, the brain, the cerebellum particularly, can make adjustments for that situation.
But it's fair to say that the treatment worldwide is generally around the same issues at this stage. Ireland is as up to speed as anywhere else.
Absolutely. I mean, there are. I mean, I know the people over there, and they are very, very competent and are very up to date on everything that's going on around the world. Absolutely.
Okay.
Absolutely.
Thanks for your time. That's Professor Gerald Leonard. I'm running overtime. That's